Have you been told that you're having a big baby and therefore have to have a C-section? How many of you know someone who that's happened to if it hasn't happened to you? How many of you have heard this as a threat almost for women who are measuring slightly bigger than they should or not perfectly on track? Fetal size is a huge reason for both C-section and induction. My name is Rebecca, and I'm from anaturalbirth.org. And this topic is really important to me because of all the women that come to me wanting a natural birth and getting sort of blindsided by their providers when they're somewhere between 35 and 40 weeks. And they're being told, we have to induce you now early because you're measuring big, or we have to do a C-section because your baby's too big. And a lot of these women obviously don't want that and want to know if they have any options. So we're going to talk a little bit about big babies today. So there's a few really important things to know about this topic. The first thing is that ultrasound can be up to 20% off in estimating the baby's size. Ultrasound and fundal height, which is where the doctor measures your belly, are the two things that are most commonly done to guess baby size. And when I say guess, it truly is a guess because even the technology of the ultrasound is 20% off, or it can be up to 20% off. So that's a lot. That's a lot, especially when you're talking about a baby that weighs maybe 7 or 8 pounds. So that means in terms of numbers that a big baby that is estimated to be, say, 9 pounds could be as little as 7.2 pounds or as big as 10.8 pounds. That's a pretty big deal, especially if you're thinking about inducing someone. If you're off to the low end, that baby probably should not only stay in a little bit longer, but could probably come out the right way as well. The other important thing to understand, should you be the person that does have a 10-pound 8 baby, like in the example above, is that true cephalopelvic disproportion, or CPD, is pretty rare. So CPD, if you look at this image, is where the baby's head and or body are truly too big to fit through the pelvis. This is actually very rare. It's about 1 in 250 births, although the incidence is a little bit up in the air from the research I did. But 1 in 250 births is the estimate I got. And so it makes sense if you think about what this means. If baby is too big to come out, we have a problem. So what did we do thousands of years ago before we had OBs helping us have babies? I mean, obviously this was a medical emergency that probably didn't end well for mom and or baby. So from an evolutionary standpoint, it makes sense that this is not that common, that your baby more than likely will not get too big to come out. And if baby does get too big to come out, it's likely that there may be something going on, something like gestational diabetes, which causes babies to be bigger, may be a reason. So it's not, it's sort of not a normal situation to begin with. So many women feel that or think that big babies are entirely genetic, that their mom and sister and cousin and aunts all had big babies and all had C-sections, so that's what they're going to have too. So there's no reason really to understand about birth or educate themselves about birth because they just know they're not going to have a vaginal delivery. And that's not true. Genetics do play a factor in baby size, of course, but it's not the whole story. Mom's activity level, mom's diet, and mom's overall health also contribute to the size of the baby. But perhaps even more important than the size of the baby is the position of the baby. If baby's in a good position, the chances of getting baby out, no matter the size, is much better. A small baby in a bad position is likely a harder delivery than the big baby in a good position. So what can you do? You can't change your genetics. You can't change the size of your baby outside of your own health, eating, and exercise. can you change your baby's position? And the answer is a little bit, or sort of, which is a lame answer, I realize. But you can influence baby's position. You're never going to be guaranteed to have a baby that's perfectly anterior and head down and everything perfect. But there are things you can do to increase your chances of this happening. So the first thing is to stay active. Stay active, stay on your feet for as long as possible, assuming that you are low risk and your doctor has given you the okay to do that. And the reason you want to stay active is because when you're active and you're upright, meaning you're standing, you're not sitting, your pelvis is not pinned. Your pelvis is a couple of different bones that's in a ring shape that's held together by soft tissue. And when you're upright, your pelvis has a little bit more flexibility, because when you're sitting on it. So it doesn't have much flexibility because your body weight is pinning it to whatever you're sitting on. When you're standing, it's not pinned. So it allows the pelvis to make small little adjustments in the soft tissue to be more flexible and to work more with baby when it's time for baby to actually pass through the pelvis. So staying active and limiting sitting are really important to helping your pelvis be ready for birth. And your pelvis being ready for birth is really important because that's what the baby has to go through. That's the tunnel that the baby has to go through to get out. The other thing you can do is practice squatting. So that opens the pelvis up. It encourages those soft tissues to be more flexible. It encourages the muscles that help you squat to be strong, because the position you're going to be in to deliver is going to be some sort of modified squat. Whether you're in the bed or standing or kneeling or whatever, you're more than likely going to be in some sort of version of a modified squat. And getting the pelvis used to that position is a good thing, because you want the pelvis used to that position when a baby's trying to come out of it. So I have a good example of this. I recently worked with a woman who had a 10-pound baby girl after 4 hours of labor, and she delivered naturally. She had no medication, and she was not a big person herself. It was her second child. Her first child was not quite as big, but also a bigger baby, somewhere in the 9-pound range. And she was very educated about birth, not from her experience with her daughter, but from taking classes. She learned through carrying her son that there was a lot to know about birth and that she couldn't just show up. She needed to educate herself about it. So she took my class. She did a lot of reading on her own. She was ready for this birth. She was also very active, and part of her education told her that she needed to be active and she needed to watch what she ate and she needed to be diligent about her pregnancy exercises, and she did all of those things. When it came time to deliver, she labored for a very short amount of time, and then she was in the pushing phase of labor, and she tried a lot of different positions. She tried squatting and being in the bed. She had hoped for a water birth and did a bunch of pushing in the water, and found that she really couldn't make much progress in any of those positions. And obviously that's fatiguing, and she's uncomfortable, and she's hoping that this thing is over with soon. And then her midwife suggested that she try laying on her side. And she knew that position from class, but wasn't thinking necessarily that that's what she needed to do. And soon after getting on her side and the midwife taking a look that baby was right there, baby pretty much came out without much difficulty. She did not tear at all. And her baby was 9 pounds, 14 ounces after going to the bathroom. So she was essentially a 10-pound baby, and she had no interventions, no medication, and it was all about aligning her body with baby's body to help her come out. So not only did she have a provider that allowed her to carry a baby that was measuring large, she also had a provider that was willing to try alternative pushing positions. She likely would have needed a vacuum or forceps had she been in in the bed, but putting her on her side solved the position problem. It put her pelvis in the best position to deliver this very big baby girl. So if you have a provider pushing you to be induced or have a C-section simply because of size, and you're low risk, you have no other medical issues, you have had a healthy pregnancy, you've been active, you need to think about maybe getting a second opinion, maybe getting another opinion from someone in the practice, getting a new provider, at least asking what other options you have, because the fact that 1 in 250 babies are truly too big to come out, there's a good chance that you're not one of them. So you need to find out exactly what's going on and leave your options open for a spontaneous vaginal delivery if at all possible, because we know that that's the healthiest thing for baby if there aren't risk factors involved. So I really appreciate you listening to this. I hope it was helpful, especially for those of you who are in this situation currently or who have been there, to understand exactly maybe what was going on in the provider's head, or maybe options that you had that you didn't explore. I encourage you to leave comments on my Facebook page. I would love comments below this video on YouTube. Please check out my website at anaturalbirth.org. On that website, I have a survey for individual coaching. I would love to work with you one-on-one to help you achieve the birth that you're looking for. I'm also going to be doing small groups and webinars. If that's interest to you, please email me and let me know what topics you're really interested in learning about. I'd be happy to help you. I really appreciate you listening to this. Thanks a lot.